on how to conduct the outbreak investigation, how to collect the sample, pack the sample, and how to ship the samples.
From Indonesia to Vietnam, and from Cambodia to the Philippines. Each country is strengthening its surveillance systems and laboratory capacity.
With FAO support, we quite confident now, and I think we have no problem with that.
Every test, every training, every safely shipped sample brings us closer to protecting pigs, livelihoods, and food security. Science on the front line means faster action, protecting pigs on farms and in the wild. Together, we build capacity so countries can enhance surveillance and response throughout Asia.
Okay, I think with that video, you might have an idea of what this session is about. And welcome everyone again. This is the Level Up or Building Capacity for ASF Preparedness, part of FAO special session under the theme of African swine fever managing with a One Health lens here at ICVS 2025. So this session focuses on strengthening technical capacities for ASF preparedness through simulation exercises, risk management strategies, and training programs that empower countries and respond effectively. So let's explore how collaboration and innovation are helping us level up ASF readiness across Asia. So for our first speaker, I'd like to introduce Dr. Sarah Jaime, our FAO Animal Health Specialist at FAO ECTAD. Sarah will share FAO's capacity building programs designed to enhance ASF preparedness and resilience. Dr. Sai?
Hello, good afternoon, it's me again. So this is more on the strengthening capacities on disease preparedness, detection, response, and recovery. It's not only workforce strengthening for the laboratory or for the field, but also for the community. Under the ASF Regional Collaborative Framework for Asia and Pacific, we have 5 pillars to prevent the spread and mitigate the impacts of ASF. But under these pillars, we have cross-cutting requirements also. This involves develop required capacity, not only the technical capacity, but also the operational capacity of having the systems for emergency preparedness and response. And also that it has to be multi-sectoral, multilateral, and multidisciplinary. For the 6 years of the project for ASF, we've provided guidelines for smallholders from biosecurity to culling and disposal, but also field manuals, online courses, videos on biosecurity, and even for risk communication. So how does it look in the field for capacity building? It may be, as we've seen in the previous session, the importance of whole genome sequencing to keep track of if we have recombinant strains or low virulence strains. It's training veterinarians on epidemiology, animal health personnel as disease investigators, but not only understanding the outbreak, but as well as training them on how to communicate to the community about the risks of ASF. It's also talking about trainings between animal health and environment personnel. If there's no strategy yet or standard operating procedure, it's opening the discussion of what to do for ASF management for both wild and domestic pigs. The trainings may not be something formal. It's maybe a learning by doing type of training when our communication officers from different countries are learning how to do knowledge attitude practices, interviewing farmers or market vendors to determine the risks of ASF. And most especially, we are training communities not only just to learn by themselves, but also the farmers as being champions to share to their neighbors how to prevent ASF. So this is just the project initiatives in numbers: 2,706 personnel trained, 32 capacity building. But maybe with this session, we have, I think, 4 presentations that would provide more stories and examples on how capacity building is supporting management of ASF and how to win against ASF. Thank you very much.
Thank you, Doc Sai. Yeah, next one. All right, I would like to welcome our next speaker to the stage. Next, we have Dr. Kritin Tongsrimu. Dr. Kritin is the senior professional veterinarian from Thailand's Department of Livestock Development. Dr. Kritin will walk us through the Thailand's ASF simulation exercise and outbreak investigation strategies. Dr. Kritin, you have the floor. Thank you.
Thank you,ครับ
And you can click if you like. Yeah, just click.
Good afternoon, everyone. My name is Kitin Thongsimuang,ครับ. I am veterinarian from the Department of Livestock Development in Thailand, or DLD. This is the presentation of a national simulation exercise on ASF in Thailand. This national simulation exercise was implemented by the DLD and in collaboration with FAO and with the goal of the strengthening Thailand preparedness and rapid response capacity against ASF. We will go through the project with the 3 highlight targets: the target participant, exercise material, and the activity. We conduct the exercise in the 3 livestock regions: region 4, region 5, and region 8. All 3 regions have the high risk area, high pig density, high density of farmer, and special characteristic. In the region 4, we have the various scale farm. In region 5, we have the more smallholder farm and ethnic group. And in the region 8, we have more medium scale farm. The simulation exercise, this simulation exercise engaged the 145 dedicated officers, comprising the professional from the provincial level and district level, officer from the Veterinary Research Center and Animal Quarantine Station. This diverse group are carefully selected to ensure a comprehensive understanding of the ASF outbreak dynamic. For simulation exercise, we use the mock-up scene provided by the FAO. The participant aim to enhance the collaboration and knowledge sharing, reinforcement, and about the Thailand preparedness and response against ASF. Okay, next slide. Okay, the activity divided into the 3 days. The first day of simulation is focused on critical lecture and knowledge transfer. Participants learn about the ASF control measure, virus characteristic, and sampling technique. Additionally, the use real-time PCR was emphasized, providing participants with the essential skill for effective response This foundational knowledge was crucial for the participant to engage in the subsequent simulation activity in day 2. In day 2, we use mock-up scene and simulation for the comprehensive ASF prevention and control practice. It includes the disease notification, field investigation, and disease and diagnosis, as well as the local control rule and then the risk communication for long-term control policy and strategy. In day 3, it is a discussion day. We discussed how to improve the policy and control strategy. We use the World Cafe technique, divide the participants into the 3 groups, group of the surveillance group, control group, and the prevention group. Okay. Sorry. For the key benefit, this exercise gives the opportunity to extend the capacity, adaptability of knowledge and registration, as well as soft skill. These happen because different departments, including central and local, veterinary, laboratory, and the inspector from the animal quarantine station be in the same place. So the coordination, sharing experience and technique among the generation and specialty occur. These are the key messages from the discussion in day 3. Why the ASF is the highly impact in the swine industry. It's safe for human consumption, so it is the responsibility for the policymaker to communicate with the consumer. The preemptive culling is still effective measure for controlling. However, it should be the last resort. And biosecurity that's convenient for the smallholder should be gathered and written in the standard format. Okay, that's all for my slide. Thank you.
Thank you very much, Dr. Kritin. That was a very insightful presentation about Thailand's efforts on ASF. I would like to give you a small token of appreciation. Thank you very much. Thank you very much. And as we proceed, I would like to welcome Dr. Suban Silitamabong. He will be presenting. He's from Lao People's Democratic Republic, and he will discuss ASF risk management and preparedness initiatives in Lao PDR from our FAO Lao PDR office. Dr. Suban?
No, Suban. That's okay, that's okay.
Yeah, sorry.
Good afternoon,
changes.
everybody. So my name is Suban Silitamawong. I'm presenting on behalf of the Department of Livestock and Fishery, Dr. Lapin, who could not make it because they have what we call the government urgent meeting. So in my presentation, we'll have 3 areas we're going to talk. What we have been support, the FAO support Lao PDR in the last 5 years. So what we call the top-down approach that we have, the ASF solution and challenge that managed in Laos, and also the project, the initiative to support policy development in Lao PDR, and as well as we touched a little bit about the Weibo value chain study that the platform from Thailand that already present, and then we expand to Laos, with conduct by the University of National University of Laos, Faculty of Agriculture.
This one. Okay. Yep.
Yeah, in Laos, the ASF has hit that in June or July 2019. I think the 4 months after Vietnam, I think, yeah. After that has been spread the whole country. As you see the number there, there's the whole 18 province, more than 170 villages that impacts, and of course they're calling the pigs, and then also at that time the government doesn't have the what we call the compensate the policy, so it's really hard for Lao government that of course they concerned with the budget as well. So. And the latest one that have been just this year, as you see, okay, and then the latest one that had been up, yes, this is what have been occurred in Laos, that in 17 provinces that we have that occur in Lao PDR this year. But you see number of the villages that have been impacted. Yeah, that's really few. Yeah. But still challenge in Laos at the beginning. Every country, I think, because that is the new emerging disease that we don't know exactly how to manage it. Yeah, and of course the low the biosecurity, especially at the small backyard, smallholder farming. If we're talking about the contract farming, will be another context that has been with the CP or Betaco. That's different context. Yeah, with the small farmer holder, that's the challenge. Yeah, and of course the close contract between the domestic animal and the wild pig, because especially in the northern province, the local people, they will raise their pigs in the what we call slum. Slum is the area that's near protected area, or where they farm, they plant the rice, plant the corn, and they also lay the pig there. There's opportunity for them to interface, interconnect each other, and limited awareness campaigns about the disease as well. Illegal hunting, of course, but in Laos, the hunting the white pig is allowed because this is a common species, and we have only one species, the Saskova, or what we call Eurasian white pig, that's allow for the subsistence consumption, but not for sale. Yeah, but you see they still sell to make money for the living, especially in the remote area, and it's the prevalent testy, the white pig. It's testy for the what we call the people in the city. They prefer the white pig meat. And the animal movement control is challenge as well when it happens, and then how to control it. Because when it happens, the farmer will try to sell it out. Yeah, even the butcher, and then sell to the market or move around. Yeah, sometimes it cause the spread the disease. Yeah. And you see, yes, there's some picture that we have, and also the picture from the white pig value chain, that even how they carry the pigs. You see how they carry the pig, and then how they move. Yeah. And the project had been supported in the last 5 years, like what we call the top-down approach. The Lao PDR has attended what we call the online training for the ASF, the control and the prevent. That's online training that Laos government staff has attended. 7 persons have been attended, and after that they continue to train the subnational at the provincial in 18 provinces, and at the subnational trainer continue to train district animal health and veterinary at the district. What we call in 148 district has been trained. Yeah. You will see the total number here. Yeah, in the last 5 years that the whole tournament had been trained about the ASF prevention and control at the field level. 514 people. Yep. And another thing that we have the focus also, we need the guideline, the policy. That's why we FAO support Lao government to develop what we call the contingency plan. Yeah, which will guide when it happens, how they gonna manage. Yeah. And also what we call the study about the white pig value chain that has been conducted by the National University of Lao. Dr. Wandapon, who also sits in this room, is a key person who they lead on this. Yeah. And you will see where the pointer. Yeah. Yeah. You see all this what have been the Kabi that we have been done in the Sanyaburi province that had support by the project. Yeah. But with the and with the white pig value chain, we select in 2 provinces. The one in Salawan in the northern, that's where the ASF happened at the beginning. Yeah. And the second province will be in Huapan province, where we detect the ASF in white pig. That's why we try to see how what we call spillover. But I think in the Huapan province, it's happened transmit to the white pig, because the local people throw the carcass to the river stream, yeah. And the white pig or white animal also use that sort of the water, so that's what happened. And in the 2 provinces had 4 districts that we visit there, and they were interview with the key informant. And then 10 focus group discussion, and the participants with farmer, trader, and butcher, hunter, and the official who work in the area. Yeah. And just try to see how they transmit and the value structure that I'm not go to the detail here at the structure of that. And I forget for the Kabi. With the Kabi project that has been implemented in Sanyaburi province, where the border with Thailand, that the 18 farmer has been selected to participate in this, and to pilot the protocol that has been developed by the regional office. That at the beginning, what the guide is that the farm or the backyard farmer who had the pig not over 20 pig, and what we will not support with the feed, piglet, and also the vaccine or medicine, we will not support. But we will support the material, the chemical, the disinfection, and then help them to improve the pig pen, or even build a new pens, and then use the practical biosecurity intervention for this. That's to save the pigs, and also to prevent the disease to access to the pig farm. This is what we have been done, and I think that now they still continue. This is if they can implement or the practice well, and then the pig will healthy, and then they can have more benefits, generate income for their family. That's something like that. That's all for my talk. Thank you very much.
Thank you very much, Dr. Soban. That's a very insightful and comprehensive look into how you operationalize ASF policies in the field. And as a token of appreciation, thank you very much.
Thank you.
Thank you, appreciate it. Thank you. And right now, I would like to invite Dr. Joshua Cruz. Dr. Joshua Cruz is from the Bureau of Animal Industry in the Philippines. and he will share their experiences in training animal and wildlife personnel for ASF Preparedness. Dr. Joshua?
Okay. Hello, good afternoon, everyone. So I'm Joshua from the Philippines. So I'll be presenting how we respond to ASF crises and in both domestic and the wild pigs. So this will be the outline of my presentation. So for the time, I will skip this slide. So right now, the Philippine swine industry, since we've got first detected ASF in 2019, so we saw decrease in the population and then the volume of production. So just last year in the Philippines, but right now we recorded lower outbreaks compared to last year. So the production has significantly decreased over the years, since 6 years that we got hit by ASF, and then we saw a significant decline in the population of pigs. So right now we are around 9.11 million heads of pigs last year in 2024 in the Philippines. That's still below the pre-ASF level. And of these population, a majority of these are from smallhold farms. So more than 75% are smallhold farms. And we know that these smallhold farms are the most vulnerable sectors for ASF, given they have low biosecurity and compliance and even awareness about the disease. So currently, our situation, we have 18 regions. So we have 4 regions that have active cases, and then 6 out of 82 provinces. But since the beginning of ASF, we detected ASF in all the regions in the Philippines and 76 out of 82 provinces, and majority of our cases are from the smallhold farms. And in terms of the wild pigs population in the Philippines, so we have 4 endemic wild pigs or 5 endemic wild pigs in the Philippines. All of these are endemic in the country, and one of the species, the Visayan warty pigs, are critically endangered species, and these species got hit by ASF, including also the Philippine warty pigs. Their population is vulnerable, but maybe because of ASF, they can be considered as endangered already. So out of all of these 5 species of wild pigs, so only 1 have XC2 population, meaning that have captive population. The rest, they are on the wild. So when the ASF got hit for the species of ASF, so all of these species could be extinct already. So in terms of wild pigs detection, in ASF, we have 3 confirmed ASF cases in wild pigs. So we have in the northern Philippines, this is a Philippine warty pigs. The problem with this population, they have mixing with the local population, so it's very difficult for them to be determined as solely as a wild pigs, but they could also be they have a generation of domestic pigs already. And then at the middle of the Philippines, we have detection in the captive population. These are Visayan warty pigs and under the project of the Talarak Foundation. So these Visayan warty pigs are used for breeding and expansion or additional population for the Visayan warty pigs. So they got hit for ASF mainly when the community got hit by the ASF. So they think that the environment and also the fomites may cause the outbreak in that captive population. And then lastly, we have in the southern Philippines, we have a mass die-off of wild pigs, more than hundreds of the wild pigs in Tagum City. The area is a plantation, coconut plantation, but it's near the forested area where wild pigs do have wallowing areas. And then in Mount Kitanglad, we have suspected die-offs also of wild pig population, but we have no means to determine if it's confirmed ASF or not. So the picture above is an example of how ASF look like in Visayan warty pig. So in the program, so the Philippines launched this National ASF Prevention and Control Programs. You have 5 components to address this issue. And one of the components is the local government units engagement. So they are the frontliners in controlling and preventing ASF. So we empower them. We conduct capacity building for these local government veterinarians. And we always coordinate with them on every actions that they need to do to control ASF outbreak. We also heighten up our surveillance and monitoring. All regions in the Philippines have capability to detect a PCR, to detect ASF, and even some provincial and islands in the Philippines already have now diagnostic capability to detect ASF for faster detection. And then we also adopted a CABI as part of the biosecurity measures and our capability and awareness. And right now we are rolling up a new repopulation plan for the Philippines to increase our population pre-ASF level. And then part of the prevention of ASF in wild pigs, currently we do not have any policy specifically for wild pigs in ASF, but we are now in coordination with the environmental department to discuss on how we could approach this concern. But right now we have this law that have conservation and protection on hunting and also on illegal trading of wild pigs. So these measures help us to prevent also ASF in wild pigs. And then we have this coordination and collaboration body, the Philippine Interagency Committee on Zoonosis. ASF is not zoonotic disease, but this body is composed of the environmental and human health and also agriculture departments where we discuss concerns. And it also includes ASF. So this next year, the Department of Health will be chair of the FICSI of this coordinating body. And then we also have collaboration with our conservation groups. For example, the Talarak Foundation, we tap them because they are the experts on wild pigs. So we tap them on our capacity building with our local veterinarians and even awareness to our farmers. And then we also conduct surveillance and monitoring. We do surveillance in areas with the wild pigs population, so we can check if the domestic population in the area have ASF, and also the DNR, the Environment Office, and the Talarak Foundation also do monitoring of wild pig population. So, for example, this Mindoro warty pig is a rare species of wild pigs. They are now trying to do a XC2 population of this Mindoro warty pig species. Also, I think these are strength, the information, education, and communication campaign. We already have now a communication campaign specifically for hunters, for indigenous people, those who do trekking, because in the Philippines there are now a lot of groups now do hiking on these areas that have wild pigs population. So we already have some regulations or some guidance for them to prevent ASF in the wild pigs. We also tap our partners to do information and awareness campaign to farmers living near the wild pigs population, and then also trained our environmental officers because most of them are foresters. They are not trained for wildlife or handling wild pigs. So we train them how to recognize disease on wild pigs. For example, they saw a carcass of wild pigs, what they will do, who they will report to, and how they could coordinate to our veterinary offices at the local level. And then lastly, one of our intervention, thank you also for the FAO for choosing Philippines for this, for the community ASF and biosecurity intervention. So the CABI was piloted in the Philippines in Sagkungan President Rojas in North Cotabato and then we expanded it in 2 more sites in Solsona, Ilocos Norte, and in Bais City, Negros Oriental. You can see the before and after photos of the farm. So currently we have produced 197 Kabi farmer graduates in the Philippines. So we saw how these farmers develop and how their behavior changed in approach to protecting not only their livelihoods but also their community against African swine fever. And an offshoot of this CABI program, we conducted a biosecurity champions training program. So these are the neighbors of this CABI graduate farmers. So this not much, this less intensive compared to CABI, but we try to adapt a training program for these farmers. We adapt using a physical copies like a brochure, and we try to make it fun for these farmers how to learn about this ASF and how they can prevent. So learning part of this CABI program is that the farmers and community comply when the tools are available and interventions match their realities, and their behavior change happens when they understood the hows and why we do this for them. And then the local ownership, because these farmers now owns the program, so it drives the sustainability. And for them, the most important learning for them is capacity building. It's how we teach them. So it's the most important resources for them. So these are example of our Kabi farmers. So we did also this biosecurity champions training to one area near a conservation area. It's in the Bayawan City. So the farmers also do visit our Kabi farmers in Bai City. That's around 1 hour drive. So they ride a bus. So it's like a field trip for them. So it's their first time to go out of the city. So they're very happy that they could visit other farmers and learn about how Kabi program influence other farmers and how it could be also for them. Yeah. So And our ways forward is though the Philippines, not only at the national government, because we presented this at our sub-national and even our provincial level. A lot of local government units came to us asking how they could implement KABI at their own, and how it could be supported. So now there are a lot of talks on how could this KABI expanded outside of FAO funding. And for the BAI side, we propose a budget for a champions farmer training. So we have now approved, not GAA yet, but approved plan and budget for next year to conduct a biosecurity champions farmer training. We are looking for 1 LGU for that. And then there are also sustained collaboration across agencies and LGUs. And we already think that this community engagement and practical biosecurity remains a key to long-term ASF resilience. And I think that's all, and thank you very much.
Thank you very much, Dr. Joshua. Hold on a second, doctors. wag magmadali. Joke. Yeah, so we thank you for your insights on how the Philippines has been dealing with training and not only animal health, but also wildlife, and including the communities around. So that's really interesting. Please accept our small token of appreciation. Thank you very much. Thank you. Okay, thanks very much again, Josh. And I would like to invite to the stage Sidet. Sidet is from our FAO Cambodia office in Phnom Penh. He will talk about how Cambodia's experience in increasing the resilience of farmers and communities to deal with animal health emergencies through good husbandry practices and improved biosecurity. So this will be another very interesting talk. Take it away, Sidet.
Yes, thank you. Good afternoon, ladies and gentlemen. My name is Sidet. I'm FAO focal point for African swine fever in Cambodia. I have spent nearly four years and a half to work with the government to conduct the prevention and control the ASF in Cambodia. Today, I'm thrilled to be here to present about increasing farmer and community resilience through good husbandry and improved biosecurity. My presentation here, in my scope of my presentation, we will focus on status challenge of ASF management in Cambodia, the joint project activity between the government of Cambodia and FAO, increasing resilience, and the conclusion. As you may know, in Cambodia, they have a first outbreak in 2019. There are nearly 5,000 pigs killed and died in ASF outbreak during that time. The outbreak is, you can see in the map, the outbreak come up with the province Ratanakiri, the border with Vietnam, in April 2019, where there is difficulty of the government to deal with because the people here are very low biosecurity. They have not agreed to accept the pig culling, and also recent situation. After 2019, the situation remained under control until the late July 2025. We have another new outbreak, the latest one in Siem Reap, Kampong Cham, and Bat Nambong. The photo show about the challenge. The photo show about the first outbreak intervention, outbreak response, clean up and burning the pig, and disinfection. Here is the challenge that the the Cambodian government faced with dealing with the ASF outbreak. There has 3 challenges. One is a free-range pig that lead to have a poor biosecurity. Second is a collaboration of the pig owner. The pig owner lost again compensation because we don't have the compensation policy. And the third one, as I mentioned, the first one in Ratanakiri, the government dealing with the indigenous community that lead to have the barrier of language to work with them. To deal with this challenge, the government have proposed a solution. Like the first one, poor biosecurity, government have conducted by capacity building, awareness training, and community forum. To do with the loss of the pig owner and have no compensation, the government has worked with the community, dialogue with the community, and provide them with biosecurity equipment, especially the disinfectant to the farmer. And to deal with the language barrier for the indigenous community, the government have worked with the local community to include one local translator in capacity building team to work with them. Regarding to the joint implementation between the FAO and the government of Cambodia, especially the GDAF, we work on the 4 queer highlight in the presentation. We work on the policy and coordination. We work on the community engagement and rapid assessment. Also, we work on the community development. On the policy and coordination, we have strengthened national and provincial policy. We have organized the national training, similar in Laos, and followed by the subnational training. And we have organized one examination contingency plan workshop for all the provincial office of animal health production, to 25 office of animal health production in the country. We have also organized 22 subnational training for 25 provinces, because in Cambodia there are 3 provinces, there are only 2 veterinarians that we need to include with another province training. For rapid response, we have building capacity for early detection, reporting, and outbreak containment. We organize 5 regional ASF SOP training. They have a total of 226 veterinarian in the provincial and district veterinarian. And we also organized one national simulation for 25 provinces in order they can simulate with the situation of the ASF outbreak. Among the 2, we have building the capacity of the farmer. We call community engagement. We have organized 150 ASF community forum. We organize 8 ASF forestry community forum, and also we have conducted 6 biosecurity champion training that we adapted methodology from the Philippines. Community develop, we have developed poster, leaflet, and another ASF IEC material. Regarding to the increased resilience, we work with the government of Cambodia, especially the GDAF, to conduct the ASF Farmer Biosecurity Champion that we have already mentioned in the collaboration work already. But here we detail what is the ASF Farmer Champion training to conduct for the farmer. As you may know, CABI in Cambodia was stopped by the USAID unfunding, and the farmer are requested, farmers selected under CABI program are requested for biosecurity training. We have opportunity to bring them to join the biosecurity champion training. This training is focused on the three purposes. One is the training, strengthen biosecurity practice, build on the previous effort, and ensure the sustained awareness and capacity among the farmers. In total, we have conducted the 6 ASS biosecurity champion training in 2 provinces, in Takao and in Province, where we as targeted as a CABI project. Another activity to increase the resilience, we work on the ASS Community Forum. As you may know, why ASS Community Forum was known in Cambodia. As you may know, this Community Forum is a notable impact, cheap, simple method, and more engagement with the local people, flexibility, and local empowerment, and also fun for the farmer. That's why it was known in the Cambodia. This community forum is not work in the place that under the animal health we have engaged it into the forestry community, where we have worked with the forestry community, forestry administration for agreement, and then this ASF Community Forum highlight the adoption of the One Health approach to foster intersectoral cooperation between animal health and forestry sector, or we call environmental sector, with aim to the prevention of ASS and transmission of wild boar and the domestic pig. This community forum indeed was very unique in Cambodia, that Cambodia could take consideration to extend to another community forum for any disease, another disease. Yes, to conclude this presentation, I would like to conclude following One Health collaboration between animal health and forestry sector is the key to reduce the ASF risk in domestic and wild pig. Better biosecurity is the only way to prevent an ASF and other transboundary animal disease and zoonosis. For poor farmers in Cambodia, low farm biosecurity make ASF control very challenging. Community forum prove effective to raise awareness, change behavior, enhance biosecurity, greater resilience to ASF, protect livelihood from pig raising, safeguard human nutrition with high value nutrients. I would like to say thanks to the GDAP and Forestry Administration of Ministry of Agriculture, Provincial Department of Agriculture, and Provincial Office of Animal Health Production, local authority at all levels, farmer and pig producer, Ministry of Agriculture, Food and Rural Affairs of the Republic of Korea and the donor, and FAO Regional Office of Asia Pacific for contribute to the project implementation in Cambodia. Thank you for your attention.
Thank you very much, Sidet. That's a really good overview of how Cambodia manage and approach ASF control. Please accept our small token of appreciation. Thank you very much. Thank you. And now we come to the time, what do you call this, usual time of Q&A. If you do have questions to any one of our speakers, you are free to do so now. Thank you very much. Any questions to any of our speakers for this session? None? Everyone keen for coffee break, yes? Okay, no problem. We would like to conclude the session. Thank you very much for coming in, and we will have a new session after the coffee break in about 30 minutes.